There's nothing more exciting than bringing a new baby into the world. It's new life. It's exciting for the parents. It's exciting for me.
Seeing my first delivery was a young teenage mom delivering full-term twins, and I wasn't much older than her at the time. Seeing her become a mother and was just transforming.
Last year, I think I delivered 128, which is probably an average year. So I've been doing this since 1978.
Well, this is Marie Jean. She was born December 18th, 2014. Well, we didn't know what the baby was, so he said, all right, last push, here we go. The doctor said, she's a girl. And so I kind of looked up at Dean and just had that moment of, oh my goodness, we're so blessed.
You know, to have that smaller community feel, you know, that, you know, we're not just another number.
We think that the personal care is really, really important.
My husband, Chris, and I met at the brew pub. I was working there and he was in for dinner. We got pregnant with Noah in January. Something just doesn't feel right. I think we need to go to the ER. Like, Noah was born in July and should have been born in October. And I had one question and I was really scared to ask. Was he gonna cry? Would he, because I'm crying. So I got there, I pushed twice, and out he came, and he cried, and I was so, it was like a relief. He is, other than his feeding issues, a typical crazy 4-year-old, boundless energy, and this crazy personality. He makes everybody smile. We love to share his story because so many people enjoy seeing the difficulties and seeing how he's pulled through and how he still keeps a smile on his face.
We just have a fantastic team, right from the people that clean the rooms, through the nurses, through the pediatricians, the doctors that I work with. It's just great.
It gives people a sense of security knowing that, you know, having some place local that can meet their needs, you know, no matter what it is.
And when we left the hospital, they said, anytime you have questions, feel free to call us any time of the day, any time of night. Having that service to us, I left feeling a little bit more comfortable because I asked a zillion questions before we left. I felt like the nurses were so nice. I felt, oh, I can call anytime if I feel nervous or I have a question about something. That was really great that they provided us with that.
We all have the same focus. We all have the same goal, is the best for that patient, the best for that family.
Obviously they knew it was an urgent situation, but they did their best to make me comfortable and not panic.
But when you are impacting a newborn, you're impacting maybe 80 years of the quality of life. So you want that to be the best that it can be. So I think there's many reasons why supporting a community hospital, even our size, in the OB department is important.
For a lot of young women, this is their first experience with care in the area. If that experience can meet or exceed their expectations, how they view the hospital for the rest of their care and their life here, I think that can help just with that first impression.